Let's meet Dr. Stephen D'Antonio, a naturopathic physician and licensed acupuncturist. In this video, Dr. D'Antonio discusses his passion for treating patients through natural and integrative medicine and why he founded Whole Family Healthcare.
And so I was preceptoring with a physician at Shands Hospital at the University of Florida, and he told me, gave me different books to read. He hosted alternative medicine meetings at the hospital, and back in the late 90s, that was the term they used for acupuncture and nutrition and homeopathy and naturopathy. And he said if he had to do it all over again, he would go back to school and be a naturopathic physician. And so I did some research, and I got an interview at Bastyr University on my spring break that year, and they were the most prestigious university for naturopathic medicine. And so during the interview process, they actually explained to me what a naturopathic physician does. So in addition to being a regular doctor where they diagnose with a physical exam, history, and blood work, they also learn about herbs, homeopathics, nutrition, and how to prevent disease and not just identify it in its late stages. And so I figured out at a young age that's the type of person I would want to go see, and so I chose to study that naturopathic medicine. So my approach to medicine is there's a time and place for everything. And so where we really thrive is treating patients from a preventive standpoint, and also when patients have exhausted all their options and they've taken conventional medicine, has nothing left to offer them. They're on multiple medications, they don't have a quality of life, and they're willing to make lifestyle changes and try something new. That's a very good patient for us. There's two key components that I always focus on first. We always make sure to optimize their digestion because we can control what goes into our body, and that has a profound effect on so many different organ systems and how we feel on a daily basis. And so to correct digestion, we start with identifying any type of food allergies. We cut out the common things that are offending agents for most people, too many refined sugars, fried foods, all the things that most people wouldn't argue about, but they've never really tried to cut it out of their diet. And so we start with the basics first. So after we optimize digestion, we ensure that their detoxification systems are working well. The body has repair mechanisms in place, and if we can detoxify all the things that we're exposed to, then we generally have good health. And when people come in with chronic conditions, usually they have detoxification issues to begin with, and then they're put on multiple medications, and their quality of life and their stress levels, all those things can really impact their detoxification in a negative way, and it has a negative impact on their health. Blessed to work for 6 years under some very good physicians. I was exposed to electrodermal screening. I was exposed to osteopathic medicine. I was exposed to chiropractic medicine. Those were not things that I personally practiced, but I worked in offices, and I was able to see the patients that I worked with who were also receiving care from those doctors and the benefits they had. And so what I wanted to create was, in one office, a collaborative setting where we could get a group of individuals, a group of physicians who were the best in their field, who would work together for the best common good of the patient. So if a person came in with headaches, we can evaluate them from a chiropractic perspective, we can treat them from an acupuncture perspective, we can look at food allergies, we can look at nutritional deficiencies, and we can offer the patient options.